Danny came in to see me as a somewhat typical, active, professional male who, as I see in a lot of males, just kind of ignore problems for a while.
The last 2 or 3 years, it's just my quality of life just went downhill. I hadn't been able to stand up and walk. I started experiencing pains in the right hip, and I just kept putting it off. Well, you know, it'll go away, and then it got so bad I couldn't hardly walk.
After a short physical exam and just seeing him walk, we obtained an x-ray, and it was very obvious that he didn't just have moderate osteoarthritis of his hip, he had advanced disease that he'd been living with for years and years, and probably more than a decade.
I was very impressed with the way he presented himself, very professional. He talked extensively about what precipitated it, why it is, and how we're going to get there to make this work. You could tell that Dr. Saadi was very interested, and he really liked what he did. It was just not an 8 to 5 go home. The more he talked about it, the more he got jazzed up about it, you know. And then we went into the navigation and the robot stuff, and he went in talking about the technology on that. So I instantly could tell that Dr. Saadi was my guy. This is the guy I like. He's precise. He's very clairvoyant on where he's going and how we're going to get there and what we're going to do. Went ahead and performed the hip surgery. I was up and walking the next day, you know, going with this, you know, with the walker and various things, and it was a matter of just 4, 5, 6 weeks, I guess. I was actually walking totally unassisted without any pain whatsoever. It was just, I couldn't be more happier with my hip.
I think Danny's doing great. I think that he recovered as fast as anyone that I've seen. Within 7 days of surgery, he was doing the same or more than he'd been doing in terms of activity with less pain from the day before surgery.
I'm very happy. I'm very pleased with the results. Forest Park was awesome. The nurses over there were super. I wanted it clean. I didn't want any issues after. I didn't want him to have to go back. I wanted to go 1, 2, 3, 4, let's get it done and get out of there, and that's exactly what it was.